Hi, everyone. My name is Janelle Friesen. I am the Public Information Officer with the Unified Government Public Health Department. Today, we're here to talk to you about how Wyandotte County is aligning with Governor Kelly's Phase 2 reopening plan. We're going to be hearing remarks today from the mayor, from our medical officers, and the director of our health department, and then we're going to have some Q&A at the end. Mayor Alvey, would you like to get us started?
Sure. This is David Alvey, Mayor, CEO of the Unified Government of Wyandotte County, Kansas City, Kansas. I just think this is a great day insofar as if you look at the data on how we've progressed in slowing the spread of the virus, we're seeing very encouraging data. And that data is very important to guide Drs. Greiner and Corriveau and Ms. Van Loo to help us relax restrictions. We've really come a long way. We've won, I think, an initial battle. Of course, we're not done. There's more to come, but so far the data is promising, and I have to congratulate Wyandotte County residents and businesses for complying with the stay-at-home orders and with the WICO restart. That's what has allowed us at this point to be able to relax. So it's been good work. Congratulations to Wyandotte County.
Thank you, Mayor. Now I'm going to hand it off to Dr. Greiner.
Alan.
I think you're muted.
Okay, I'll start over. Thank you, Mayor. Hi, I'm Alan Greiner, the health officer here at the Wyandotte County Unified Government Public Health Department. I want to echo what the mayor just described as real improvement and really a good community effort to make a difference to control this virus spread and control the impact that Corona would have or could have had on our local health systems. I believe we've all come together and made sacrifices. We realize that's been difficult for people, but we believe now with the data we are seeing that we can move forward cautiously and begin to reopen some segments of society. We'll talk here in a minute about some of the differences between where we were in our red zone in Wyandotte County and what we will be going to with what's called Phase 2 of the Kansas Ad Astra reopening plan. We'll continue to watch data closely here at the health department in the coming days and weeks, and we'll continue to encourage our citizens to engage in those healthy behaviors that we know can limit spread. So we'll go over those today as well. Thank you.
Dr. Corriveau, I believe you had some remarks as well that you were going to share.
Thank you, Janelle. Hi, everyone. I'm Erin Corriveau. I'm the Deputy Health Officer here in Wyandotte County. As Dr. Greiner said, we're going to suspend our red zone here in Wyandotte County, and starting tomorrow on Friday, we're going to Phase 2 of the governor's plan. The reason that we decided to do that is we're really interested in creating a situation where we're all on the same page in our community. We realize that we oftentimes work in Wyandotte but live in Johnson or vice versa or whatnot. So we're all going to go together on the same page here. We feel like this is a safe thing to do here in Wyandotte County. As others have talked about, we've really flattened the curve, which is really very encouraging, and compliments to all of you for helping with that as far as social distancing, wearing masks, and that sort of behavior. You know, the things that we're watching really carefully as far as our disease curves, the number of deaths we have in our community, and also the number of hospitalizations all appear to be trending down, which is encouraging. We're going to be staying in the Phase 2 of the Ad Astra plan for at least 2 weeks. And during that time frame, we're going to watch the data very carefully. We hope that at that point in time, we'll be able to relax restrictions more. But as we know in Wyandotte County, initially we were hit pretty hard with the coronavirus. So we may have to stay in Phase 2 longer than surrounding areas. We'll make that judgment call when the time comes. But for the time being, I just want to encourage all of you in Wyandotte County to still play that role in keeping each other safe. And there's several ways that we can do that. Them again is to really wear a mask. Wear a mask when you go out in public. Wear a mask when you're going to be around people who are not in your family household. The other thing we'd like to encourage is to maintain that distance, that social distancing practice from others who are not in your household. And we think that that's really very important to continue to decrease the spread of the coronavirus. Dr. Greiner probably has a couple more tips also to add in that way.
Thank you, Dr. Corriveau. We also want to stress that hand hygiene continues to be incredibly important going forward. We want people to wash their hands with soap and water for 20 seconds as frequently as possible during the day, and use hand sanitizer frequently if they can't get to a sink and soap and water. We want people to pay attention to not touching their hands with their face, and when they're wearing masks, not touch the mask and frequently readjust them. That can cause problems as well. Make sure you're wearing that mask over your mouth and nose whenever you have it on, and train yourself not to be using your hands unless they're completely clean to take it on and off. We also want businesses. We encourage businesses to be part of our team in encouraging hand sanitation amongst workers, customers, and the face mask wearing as well amongst both workers and customers. And the social distancing is something that we believe businesses can carefully monitor and again keep everybody safe by working together to do that.
Thanks, Dr. Greiner. My name is Julianne Van Loo, and I'm the director here at the Unified Government Public Health Department. The other thing we want to really continue to encourage all of you to do is if you have any symptom of COVID, please go get tested. We have the capacity that we need here at the health department, 1 to 5 p.m. Monday through Friday, to test you. We also are working with our partners, Vibrant Health and Swope Health, to stand up pop-up testing sites in the community Monday through Friday. These are all options for you. You know, this is good both for you as an individual to make sure you're taking care of yourself and your family, but it is also the only way that we as a health department and as health professionals know the status of the spread of this disease in our community. So please go get tested. I'll throw it to you, Janelle.
All right, we're going to move on to our Q&A. The first question is for Dr. Corriveau. You've mentioned the importance of following the data. Can you tell us more about what data you're using to make decisions about reopening?
Sure thing. So as I mentioned, we're really looking carefully at 2 weeks worth of data. And that's because the incubation period of the COVID-19 is 2 weeks. And so we want to look at rolling averages of numbers of deaths in our community, numbers of hospitalizations. And then, even as we increase testing and get more and more positives, we're looking at the percentage of those tests that we do that are positive. And so that's very important. We'd like to see that trending down as well. And at this point in time, all 3 of those measures look to be going in the downward direction. And so that's why we feel confident moving to phase 2.
Thank you. All right, Dr. Greiner, what are some of the key differences between the red zone and phase 2?
So the red zone here in Wyandotte County was really very close to how our stay-at-home orders were in the early days of the epidemic here. We were very cautious in that zone, and we allowed individuals to get together in groups of 10 or less in some circumstances, but we kept restaurants closed. We had businesses open, but only for curbside pickup or for one customer at a time to come in and pick up items that they order over the phone or online. And we really had schools and higher education institutions only operating with virtual and remote technology. So in phase 2, some of that changes. We allow individual groups of 15 people or more to get together. We encourage, of course, social distancing in those situations, but that's allowed now in schools and other educational institutions. Restaurants can now open, as long as they're set up to allow that 6-foot social distancing between individuals or between family units from the same residences. We allow some additional activities in religious and faith-based organizational settings, again emphasizing that social distancing. So there's a number of differences, but we really want people to engage in the mask wearing, in the hand hygiene, and in that careful social distancing as we go forward, so that we don't have to delay or possibly even go back to some of the more strict orders that we had previously.
Thank you, Dr. Greiner. Julianne, Wyandotte County has been hit harder by COVID-19 than many other communities in the metro and in the state. What does that mean for reopening our county?
That's a great question. Most of you know that Wyandotte County has been a little bit slower to start our reopening than some of the other jurisdictions around us. And this has been very purposeful because we have a particularly vulnerable population here in our community. So we know that those who are vulnerable, like those who experience heart and kidney disease, have certain types of cancers, have underlying comorbidities like diabetes and hypertension, are really at a high risk to contract COVID-19 and also to become seriously ill from it. So we really want to make sure we continue to be cautious, and then we urge those who live and work with the vulnerable among our population to be particularly careful.
Thank you. All right, we heard a little bit from Dr. Greiner about what this phase 2 means for businesses. Mayor Alvey, something more specific about businesses. What's being done to help organizations and businesses that may need small regulatory or zoning types of changes to operate more successfully under existing restrictions?
Yeah, thank you. What we've tried to do is we've given really direction to our planning and zoning department to try and find ways to accommodate businesses to be able, let's say, to move out onto the sidewalk. There are some codes that do not allow that. So we're working through some of those things. We want to make sure that we can accommodate as much business activity as possible, because we want our small businesses to be able to survive. I've been just so encouraged what I have seen from some of the larger businesses about how they've worked around and really continue to make sure they keep the social distancing, they disinfect, they try to protect their coworkers, their employees, their customers. And what we want to do for small businesses as well is find those workarounds. So that's on a fast track, and I believe that there'll be something coming forward to a standing committee, not this coming Monday, but the following Monday.
All right. All right, our next question is for Dr. Corriveau. If the numbers are looking better and it's safe to start reopening more places, why do we need to wear masks?
That's a really good question, because of course we are encouraging people to still wear masks. You know, we think that wearing a mask actually reduces the spread of the disease quite a bit. And we're especially worried about, those times when we're in touch with people who are not part of our families, when we're in close contact with them. This virus spreads through respiratory droplets. And so when we speak or sneeze or whatever, cough, and another person catches those droplets, there's a really good chance that that virus can spread. I mean, this virus is no joke. It spreads very easily. So we think that wearing a mask is actually a simple act of love and respect to everyone. We especially worry a lot about our most vulnerable patients and people who, have underlying conditions. Maybe they can't handle the virus. And so again, it's just an act of respect. And so I'm always happy to put a mask on. It's no big deal when I go to the grocery store.
All right, we have another question for Mayor Alvey. Do you have any message you'd like to share with residents and businesses as our community prepares for Memorial Day weekend?
Yeah, I think my primary message is, first of all, congratulations for all the hard work you've already done. Thank you for doing that. And just remind ourselves, always keep in mind that we have won perhaps this first battle against COVID-19. We've really slowed the spread, and we have not overwhelmed our healthcare system. That was the key. That was the strategy. That was the objective. So now it's a matter of, let's preserve that victory. And it's not going to be helpful for us if we assume that we've beaten this and the virus is gone. It isn't. If we give it oxygen, it will flame up again. And so everything that Drs. Corriveau and Dr. Greiner have mentioned, let's continue to maintain those practices. That's our best defense. Let's do that.
Thank you. All right, we have one more question for Julianne. How can people find out more about what is included in phase 2?
Great question. We're obviously trying to put this out through media outlets and our social media, but we'd really encourage people to go to ycokck.org, which is the Unified Government landing page, and you'll find there a quick link to all of our COVID page with all of our COVID resources. On our COVID hub, you'll find not only all the data and information you could want around COVID and how we're progressing in our community, but specifically a page that details the governor's 2.0 plan, the various folks in our community, how it impacts them specifically by type of business. So we would encourage you to go there, and please let us know if there are things that you're hoping to see on our webpage or other media outlets. We want to make sure we're providing you with all the information we can.
All right, great. Well, thank you all so much. This has been really helpful to learn more about what this means for Wyandotte County. Just a reminder to everyone, if you want to learn more about COVID-19 in Wyandotte, you can go to wykokck.org/COVID-19. You can also call 311 for more information and resources. Thank you.